to me.
So welcome again to my 18th Brain Health Lecture.
18?
Yes, I'm Dr. Cindi McGarvey. I'm a board-certified neurologist. I practice here in Indianapolis. And this is my colleague, Dr. Douglas Strobel, who is also a board-certified neurologist.
Yep. Took the test and everything.
Yep, and this is his wife, Natalie. So she's here to make sure we're falling in line and doing the right things. We have a bag here. If you'd like to come and sit up front, you may, or you
We
can
have
sit in the
cards,
back, whatever you
we have
do.
bags. So if you have a burning question,
We have
we'll do our
cards.
best.
If you'd like to write a question on it, he might need a.
Is anyone here for the first time? No first timers? Oh, first timer, okay. So Dr. McGarvey and I both kind of took a long route to get here, I guess. You did other things before you went to medical school.
Yes, so
As did I.
Originally, after I graduated from DePaul University in Greencastle, Indiana, I worked on my PhD for 3 years in the Department of Pharmacology and Toxicology at IU, and then decided that's not really what I wanted to do. Got my master's in toxicology and worked for several years in the Department of Nephrology down at the IU School of Medicine while I got my prerequisites for med school, because by that point I'd figured out that's what I wanted to do. And I entered med school at 28, graduated at 32, then did a year of internal medicine at St. Vincent's, 3 years of neurology at IU, and then a fellowship in neurophysiology. I've been practicing at JWM Neurology, Josephson Walk in Munchauer ever since, which is next to St. Vincent's Hospital.
Yep. So I went to IU for undergrad. I joined the military, and college wasn't really, I don't think, college material because it wasn't very focused. Cindi can speak to that probably in great detail. But then, so I joined the Marines, and the Marines said, you're going back to school, you're going to get your degree. I get my degree, and then there was a delay in getting placement, and the Navy said, well, if you do a transition in the Navy, you can become a Navy guy. So I got a Navy commission, was a Navy pilot for 10 years. And then when my oldest daughter was born, who is now an OB up here in Carmel, OB-GYN, when my oldest daughter was born, I decided I was going to be home, no more Desert Storm, Desert Shield stuff. So I took those big thick books to get ready for the MCAT, took it to sea with me, started prepping for the MCAT. I landed in Texas, taught ROTC, got into medical school, did University of Texas Medical School and residency, and then came up here because I heard Cindi was here.
Right.
So
That's actually where we met.
yeah, we met here. We met
became
in
fast
our group.
friends.
So, but yeah, I'm semi-retired. I do what's called concierge neurology. So I just, I love working at JWM. I love my job. But I wanted to boil down to see fewer patients and have a different type of practice. I don't miss the call. I miss the day-to-day challenge. People say, do you miss it? Well, I miss being a Navy pilot. Yeah, I miss everything I've done in my life. It's just different. I do the same job, just a different, I can do things like this. I don't know how you fit it in. We were so busy. But that's me. I have two daughters. I have one who's a doctor and one who's a lobbyist for Nokia. I don't know where that came from. She's a lobbyist for Nokia. She used to work for Susan Brooks. She used to work for Congress. Like right out of college, she's kind of a weird success story. She literally like packs her bag and goes to DC and didn't have a job or a place to stay. But she's like a devout constitutionalist. She like really believes. Her Gov Law teacher at Lawrence Central was inspirational for her. And so, but that's my wife Nat back there, and she has two boys, and we're raising them together.
And chickens.
And chickens. We have a little farm we're working on.
Hey, Natalie, this isn't on. Does that matter? This.
I make my bald spot come out. You want to draw?
Okay.
Oh.
So I drew the first one.
Okay.
This one is from an audience member, and it says, does lion's mane supplement help your memory, and also does marijuana hurt the brain?
So what you'll learn about Dr. McGarvey and I is there's no in between. We either completely, utterly agree, or we will pull the knives out.
No, we won't, but we might disagree.
She's like the sister I'm glad
I
my
think we're
mother
very
never
honest
gave me.
with each other.
We are very honest, but we have a lot of respect for each other. So what do you think? I think lion's mane absolutely works.
I think it kind of depends on the situation.
Oh, like what are you trying to fix? Yeah.
Why is somebody having memory impairment? Just because somebody has cognitive dysfunction, it can be due to a number of different causes. So if you take, can you hear me? I'm sorry. Are you able to hear him?
I'm in the green.
Just because you have memory impairment doesn't mean it's due to a specific cause that might be helped by a particular drug. Now, people think that supplements are not medication, or you might be of two schools of thought. Some people think it is medication when it's actually a food product because the FDA doesn't actually regulate it, so you don't actually know what's in there. Other people think of it as an herbal and completely benign, but very safe and can't be toxic or have side effects. So both of those theories are wrong. It is actually a chemical that goes into your body. It can influence how other drugs are metabolized. It can give you side effects as well as benefits. And when somebody has memory impairment, it's important to figure out why they have memory impairment. Some of these reasons are very reversible, possibly a structural abnormality, a vitamin deficiency. Depression can have a pseudo-dementia, which is treatable also.
Well, I think a different...
Urinary tract infection can cause delirium, which looks
any metabolic illness.
Any metabolic illness.
Yeah.
So again,
I had a patient tell me one time, like, well, what is your day like? And like, do you have any side effects of your meds? And he said, Doc, if I eat a big lunch, I have side effects. So his point was well made. It kind of talks about what you're saying is,
no matter what you do.
No matter what you do, you're going to have a side
effect.
It's not a side effect, but I think with lion's mane, it's a mushroom derivative. I think it's been around for a while. Joe Rogan really made it go over. I haven't heard that episode, but that's the feedback I've gotten. I think it doesn't make you smarter, okay? So we live in a world with those, right? So we live in a very distractible world. And if Dr. McGarvey was trying to talk and I did this every couple of seconds, she's going to... Right? She's not going to retain. You're not going to retain. So it's the distractibility that I think is often misperceived as memory loss. And so I think what caffeine does and what lion's mane does, what exercise does, and exercise is a whole different story, is it helps you with your distractibility.
Yes.
And I think that the biggest thing on the exercise is it's got to be weight-bearing exercise. Or I would say like stress-dependent, like bands and things like that. Because it stimulates growth hormone, and growth hormone is banned in professional and college sports because it heals you quicker, right? It's really good for you. And I think the number one cause of growth hormone deficiency is sedentary lifestyle.
Okay, but back to the physical activity. That is the number one thing in place of like a chemical like this, I think, to help you with focus and with memory. If you put this on top of someone who was doing everything else right and ruled out metabolic problems that are correctable and that sort of thing, it may be of some benefit.
Meds.
But if you're dehydrated, if you're drinking a lot of alcohol, if you're sedentary.
If you're doom scrolling till midnight and
right,
getting up
if you're
at
doing
6
all these
a.m.
other things, this is not going to be much of a benefit.
Right. So you can't overcome bad behavior with a good plan.
And then the marijuana.
I think it's bad for your brain. I'll be honest with you.
Yeah.
I
wish it wasn't. I think it has some good properties in that it relaxes some people. It relaxes motor issues, spasticity. It does.
It's good for pain.
Yes.
It's good for migraine.
But if our goal is kind of longevity and having our brain health long term, it's not actually that beneficial. In addition, indirectly hurting the brain in that it has an anti-motivational syndrome with it. And so you're less likely to eat right, you're less likely to exercise, you're less likely to maybe join a class on learning French, which is something new that would stimulate your brain. Anything that you do differently that's going to challenge your brain, like doing push-ups for your brain, is going to be beneficial. Again, if
standing up.
Anything that does that, anything that makes it less likely that you do those things, it's not going to be beneficial long-term for your brain. So I'm not a big fan.
I'm 62, but I can remember teachers saying, everyone stand up, right? And they would have us bounce on our heels. So I tell patients to do that to this day. I went 30 years and didn't do it, but then I read a great article about it. So I think that the tetrahydrocannabinol, one is that thing is like a bouillabaisse, okay? It's a stew. It's not just one thing. So it would be like saying, hey, I'm gonna put you on simvastatin. But if you do a THC equivalent of simvastatin, you're getting atorvastatin, simvastatin, you're getting all of them, and you don't know which one's causing you a problem. Those molecules, while they have a certain class effect, they do also have a very single-minded effect, but I don't think there's a lot of data to support its
And again, it's not
daily safe
clean.
use.
You're not having the FDA say, I'm only going to have this chemical in here, what you're buying. If you
1
buy
milligram.
like a cannabinoid here in Indiana, or if you buy marijuana outside the state where it's legal, you don't know exactly what you're getting. You're getting like he said, a bouillabaisse. Is that what you
Bouillabaisse,
said?
a stew.
So I think it's
I mean,
really
it's a mix. And
scary.
it's, think about using the example of what's your favorite red wine or white wine, right? Those vary from year to year, even though they're grown on the same vines from the same grape. Those are very environmentally dependent, right? And it just take out that the wine, what's the wine guy?
Different batches.
Yeah,
too.
different, but they design them to be the same every year, but they're not.
Right.
Think about that as a marijuana equivalent. And so I think it's great for, like I have patients with multiple sclerosis, and MS pain responds very well to THC. Not so much to CBD, but very well
But
to
again,
THC.
it's illegal here in Indiana.
It's
so
illegal.
we are not promoting it. Okay. So do you feel Alzheimer's research is overly focused on
malpractice.
amyloid protein deposits on the brain when you look how unsuccessful all the results have been? Do you want to start off on this one?
No, you go
Okay.
ahead.
So
Amyloid.
the problem with the amyloid therapy I find right now is that the results don't translate into a greater quality of life or longevity in the long run, and they carry with it significant risk, like about 30% of a lot of those drugs, wouldn't you say, for a big side effect that could be potentially long-term and damaging.
And that's our
So-
bread and butter. Risk, benefit,
Right.
risk, right?
And amyloid is one of the things that's going on, amyloid deposits. And we've got
just
dry
keep talking.
erase if you want to draw.
Well, I'm going to show them the way Doug thinks
Okay.
up here.
I'll let you set up and then I'll.
Keep talking.
Okay. So one of the areas right now is working on, immune cells in the brain, like the microglia, and stimulating those and having those clean up the amyloid. Well, there are a lot of different causes for dementia. It's not just all Alzheimer's, which is the amyloid and the tau proteins. There are different types of dementia that have different depositions of other things. So if you don't get the diagnosis right, again, if we're targeting therapy, the therapy we're targeting towards Alzheimer's is not going to be all that successful. So it's really important to get the diagnosis right and then talk about, is the risk-benefit ratio going to be better using this medication versus something else. I don't have anybody right now, I have some people in research study that I've referred, but I don't have anybody that I personally am infusing with any of those medicines because I want to see a little bit more.
I've referred people for research.
Yeah,
but-
they're in research, but even though they're out on the market, I'm a little bit more hesitant to see what the outcomes are and it's the benefit.
And Alzheimer's is not just Alzheimer's, right? It's like saying blue. When I say blue, somebody's thinking navy blue, robin's egg blue, whereas there's different flavors and shades of Alzheimer's. There's young onset, which we know is a little bit more aggressive and severe with a sooner onset or sooner demise than the others.
More rapidly progressive.
Yeah, and we've narrowed it down to 60 different genes now. I mean, we're not very good at, like whoever had that question, we're not very good at it. That's why we're having trouble treating it.
Did you say 60 different genes?
Genes that will influence
Like you've heard the ApoE.
ApoE, and there's one that if you have one copy and a copy of something else, you're more likely to have Alzheimer's. But if you have two copies of this one that's really bad for you, then you're protected. So yeah, so it's very, and I have a graduate degree in genetics, so this was like something I learned in the way back. And it's frustrating for me because I like to draw a line like this so that I can explain it to people like you. But the way I also have a very simple mind. I'm just a kid from Shelbyville. Think of Alzheimer's like crabgrass, okay? So it starts like this. And jump in here if I'm saying anything incorrect. It spreads contiguously, which means cell to cell. So I give to you, and then you give to those. So it's like crabgrass, and it takes over your brain. It takes over your yard. And when we reverse it, it goes back the same way. So those anti-amyloid antibodies and all these things that we're trying to manage it with, we're really not managing it, right? We're not turning back the clock yet. We're keeping it from getting worse. So if I say anything incorrect, Cindi won't hurt my feelings if she says something. But I think we are overly focused, on direct answer to the question, I think we're overly focused on the amyloid. I think you're better off modifying risk factors, which Dr. McGarvey and I are big on. Like she said, learn French, play a musical instrument, exercise. Because the best people spend thousands of dollars on growth hormone injections, when all you have to do is walk for 20 to 24 minutes every other day. So this is Dr. Doug's view of the FDA, the way we work. If your drug has a benefit and no side effects, which means it's better than a drug that we use already, and it has either the same or fewer side effects, that's, wow, right? That's $1 billion drug. If it is not better, but it has fewer side effects than an existing drug, yeah, okay, I'll put it into the mix. I'll put it up against the competition. If it's better, but it has side effects, well, now we're doing this, right? So these two are basically equal, right? So if it's not better, but has no side effects or fewer side effects, or if it is yes better, but yes has side effects, then an existing drug, why would you take it, right? And believe it, this is my mind. Price is the side effect, right? That wallet biopsy, price, if you can't afford that drug, I'm gonna find something that you can. And why would you prescribe a drug that is not as good and has more side effects? So we call that corruption.
And when we say prescribe, it doesn't just mean drugs. It could mean walking for 30 minutes a day, like he just said. That should be something we're willing to do to enhance our brain rather than just taking a pill or getting an infusion.
And you know what's great about that is no copay. No copay for 20 minutes of exercise every day.
Here, this question goes along with it. It says, is there a difference in memory decline between men and women? So actually, yes, there is. Hormones have been shown to be influential.
They're having a good time.
Yeah, they're happy people. And so because of that, there is definitely a difference between men and women in decline. And for women, there's a silent, there are silent genes on the X chromosome. You know how men are XY, women are XX. Many of those genes are similar, are the same. And so one X kind of remains silent for a lot of your life. But then as you grow older, some of those genes become a little bit more active, and they've shown because of that genetic makeup, many women have a little bit more resistance to the cognitive decline.
And
Do you want to say anything?
well, just that, what do men do more than women? This is something that we were talking about. There's an environmental effect that's going to affect your memory and mimic Alzheimer's, concussions, head injuries. So men do more contact sports.
Yeah.
And there are a lot of sports that, you know, everyone out there is thinking a football helmet, right? Football, hockey.
Cheerleading.
Cheerleading is actually a good one. Soccer. So Europe did 10 years ago, players who had a reputation for doing headers, right? And they split from their age-matched peers in academic performance. And that does not go, I think that's probably a chronic concussion, like post-concussive syndrome. That will mimic Alzheimer's. It's very subtle. And we have these fancy tests that I don't think there's any utility in prescribing them or paying, the PET scans, PET FDG, which tells you which parts of your brain are metabolically active. I think that's the best way to diagnose Alzheimer's, but there's no treatment. So
Well, the best way is under a microscope. But
well,
you don't
true.
want to do that.
Like postmortem.
while people are still
No one
alive.
volunteers for that.
So, yeah.
That's it. That's all I got.
Yes.
Why are there more women in memory care units then? If it's
They just outlived men, I think.
Lifespan. Yeah.
Yeah, you go to church on Sunday or on like Wednesday morning. It's all women because all the men are.
Did you fly off aircraft carrier?
I did the Kitty Hawk and the Carl Vinson.
You read about these guys from Top Gun
What? The ones who the fighters?
killed themselves?
I have not.
The micro going from 0 to 160 miles an hour.
That explains a lot, though, doesn't it, Cindi? No, I mean I did 300 of those in my career, so
This guy did 1,200.
yeah, that's a few. I don't think it's, you're supposed to put your head against this rest, right? You're in an ejection seat. And so it doesn't surprise me, but guys you would get what's called a soft catapult. So they would lean their heads forward and they could tell, do they need to eject? There we have a handle right here. That's why I go like this. We have a handle right here and we have one up here called the face handle, which if you get a soft cat, if your head doesn't hit it hard enough, you grab the handle and you're out, you pop out. It doesn't surprise me, but these guys are committing suicide.
Well, they forced him into retirement.
Oh, yeah.
These are guys who were like, the one guy who ran Top Gun, and when he
No, I haven't seen that.
retired, or they forced him, first they sent him, I don't know, they sent him to Thailand and they put him in a mental ward that was a lockdown. He escaped, they took him.
Crafty.
And they forcefully retired him.
So it's multifactorial, probably not just due to one factor of his life.
Yeah, it's like a lot of these athletes are misdiagnosed, I think, as bipolar. If you look at the Diagnostic Statistical Manual, the DSM.
The Navy was covering, they didn't want to talk about it.
Oh,
So that was
I'll bet.
when this evidence came out, that it was the family members who said, these people, my dad came back and, this is what it was like.
More than one person.
Yeah, well, and if you look at the ones who are topical, and there's more football players probably than there are Navy pilots, but the New England Patriot who killed his family and shot himself, and they looked at his brain afterwards. He didn't have Alzheimer's; he had post-concussive syndrome. And then Junior Seau shot himself in the chest because he wanted
to keep them brain.
He wanted them to study
Yeah.
his brain, so it killed him. Yeah. So and it will mimic. So people with these micro concussions, like what you're talking about, they will have brain fog almost continuously, but they'll also get what I call brain fatigue. They'll get fatigue of their mentation over the course of a day because they're diminished in resources. And I have a protocol for concussion. It's 50%, 70%, better than most, but it's...
This question says, what happens neurologically at the end of life as the body shuts down? So is this more what is the experience or what happens biochemically on the cellular level? Does anybody have a specific?
What is the experience?
Okay. Well, that's a big question. So we're going to stay away from spiritual, I'm guessing. What people normally experience in the 24 hours or so prior to passing away as the body is shutting down. Again, there's a buildup of oxidative stress and the antioxidant and oxidative stress ratio is disrupted. People can have an awakening around 24 hours before.
They get better.
They get a little bit better.
You think they've turned a corner.
It's like you're going in the right direction, but it's not actually.
And I think it's their organs shutting down. So the brain, the heart, certain organs are preserved as the rest of the body starts to die.
And then patients would experience, depending on the cause of death, if it's a lack of oxygen or blood pressure or arrhythmia or a clot or something that's happening where you're not getting enough blood or oxygen to the brain, the hypoxia, that the phenomenon that is, it's not an unpleasant experience. It's kind of like a sense of euphoria a little bit, kind of I don't want to say a high, but
it's ketosis. Like your brain doesn't use sugar, it uses ketones. So as your body goes into ketosis, it gets this flood of these ketones. And so,
yeah, it's not an unpleasant phenomenon. It's not a painful thing if that's the cause. I mean, I'm not talking about body pain. I'm talking about the brain's perception of what's going on. It's kind of like a drifting off. Sometimes it's a bright light that people experience, kind of like if you're passing out, if you're about to pass out, that sort of experience that you're experiencing. If it's a lack of oxygen or blood that's causing you to do that.
There's a neurosurgeon who wrote a book, I think, called Proof of God. I'd have to look it up. My phone's over there. But so he's a neurosurgeon, and he had this near-death experience, and he talks about that in great detail, like what it's like. And they, as neuroscientists, we want to explain things on a molecular, cellular, brain system level. And so they say, well, the reason why you see the bright light is because this is a primitive cortex. and so it dies last. Your frontal lobes are much more perishable. That's where your uniqueness lives up here.
Your thinking ability,
Your hard drive,
You're not
your
having a lot of
memories.
insight or judgment during this time. You
So-
might start to feel tingly and numb everywhere.
Yeah, so that's if not suspended, stunned. But this dies last, and the respiratory centers are like way down here, like at the base of your skull, and so that's why people tend to breathe.
They keep breathing because your primitive brain is down here in your brain stem. So your heart and your lungs keep going even though the brain has already shut down.
And we really only see, I don't know, I'll speak for you, but when we were seeing 30 patients a day, maybe one every 6 months
Of what?
of true brain death.
Oh, I see it more often than that.
Yeah,
see it
so,
more often than that.
and they're the fentanyl overdoses.
'Cause I
and
rounded the heart
smoke
center, too.
marijuana. And, oh yeah.
Yeah.
You see the cardiac.
Yeah.
Yeah, I didn't round a heart, but yeah.
So
Answer
it's
your
kind of,
question?
you kind of get a floating feeling, like a numbness, tingling, and you're sort of floating. It's sort of like you lose sense of attachment to the rest of your body.
Did that cover your question? Yeah, I'll look up that proof of God. It's an Indian surname, but
Yeah, it sounds familiar. What is the difference between Medicaid and Medicare, and what are the most important points I need to know about these?
the most important thing you need to know is doctors know nothing about it. So, no, I'm serious. So,
We know less than you.
yeah, we have. Well, and so I had to teach myself, right? And so the way I think about it is Medicare is fed, Medicaid is local, right, state level. And so your Medicaid gets inputs from the federal level on a state-by-state population level basis, okay? The best way, so there's Medicare, A, B, C, D. 65 or older or younger than that and rather sick, like renal disease, heart failure, can't work. I always think of as A is for away games, so hospital stays, inpatient hospice. It will do some home health if you're deathly ill, right? But that's basically for away games. B is, you have to kind of stick with me on this, B is the buddy system, which means do you need DME, durable medical equipment, like a
Walker,
walker or a
Wheelchair.
CPAP machine. It'll also pay for ORVs with Dr. McGarvey, office return visits with Dr. McGarvey. And all of the A and B, I'll kind of lump together right now, those actually have a premium, which I think is unfair.
to have a premium?
You have to have a premium to use, and if you don't sign up at the age of 65, they charge you a penalty for not signing up at the age of 65, which to me is breathtakingly corrupt.
They want to get the money.
They want, yeah, but you already get, it's your money. Give it back to me. Anyway, so Medicare Part C is combined, right? So Medicare Part C is a lot of private insurances, commercial payers. I think none come to mind.
I don't know.
HCA, like Columbia. That's where they'll buy out your A and B, and sometimes your D, and I'll get to D in a minute. And they will take care of it for you, and you'll kind of have both cards. You have your Social Security card or your Medicare card. And Medicare falls under what we call CMS, which is the federal branch, the federal bureaucracy that covers that. And then D is drugs. And did you ever learn what a donut hole was?
Yeah.
I just learned, like in the last year or two. But so even your medications, even though it says your drugs are covered, it's really no more than $50 a month, as low as $5. I think it caps in the thousands of dollar range. And here we are in 2025, and we don't know what those numbers are yet. They have not yet decided. But I would advise everyone this is back to the iPhone. There's two really wonderful apps. And I think they're different apps, they're free, but they access the same databases. One is GoodRx, and one is, I forget the name of that. I'm drawing a blank. I'm getting tip of the tongue phenomenon.
I forget.
Yeah, it's I forget RX. But anyway, you can put in didn't you just use that, Nat? The GoodRx for something?
It often is cheaper.
So they'll charge you your $50 copay if you're foolish enough to pay it. Or you can get onto GoodRx or whatever your My Lowest RX, look that up, and they basically have an insurance card for everyone who downloads the app, and it'll be $7. So yeah, they'll take the $43 difference and say, thanks for your money. Or you
They
can
won't
say,
tell you about it
nope.
either. You have to ask.
Right, and they put these, like the bigs, the CVS's and Walgreens of the world, they will take your Walgreens, manager in a competition against your Walgreens manager, and somebody's going to get fired at the end of the year. And so they're skimming every little penny they can. So it's a business. They're not a charity.
The next question is, do we have to worry about the microplastics in the brain? And the second question is, why does anxiety increase with age? Chemicals versus experiences. So microplastics in brain. Let's start out more globally. Microplastics in the body. And the evidence is, yes, they do accumulate. Especially blood products are collected in bags that have plasticizers, and those plasticizers have been found in patients who've gotten transfused. Also, if you microwave in plastic, those plastics can go into the food, and you're ingesting those as well.
If you leave a bottle of water in your car.
If you leave a bottle of water in your car, especially if it's a heated situation, more of those plastics go into the water. So, people, if they want to decrease the risk, they're going to microwave in like a ceramic thing, like Corningware, and not in the plastic bag that it says is microwavable. Again, it's really difficult to go back years later once you have the cancer that you have and say, oh, it was due to microwaving in those plastic bags. What we can do is say, let's look at the evidence. In animal studies, when you expose them to the chemicals that are leached from these bags, either blood products or food, then these animals come down with hepatocellular cancer is a big one, but they can, again, accumulate in other parts of your body. And one of the mechanisms is it's called peroxisome proliferation. It's something that I studied when I was in toxicology. And we don't always know, because we're not sampling people as we give them these plasticizers, how much effect it's going to have long term.
What would you even measure? Like what lab do you order?
Right.
Plastics level,
Yeah, because it's going to go into your tissues. So I'd say if it can translate from an animal study and we're not that different from that animal that they've studied it in, I would say avoid whatever that is. But you're never going to know unless we take people and at autopsy we look at all their body parts and their chemicals. So it's just kind of avoidant, kind of hope for the best. With the anxiety piece, chemicals versus experiences. I think some people are more predisposed to get anxiety. Maybe they come from a family where genetically there's depression, anxiety, OCD, sort of mental health history. Sometimes it is experienced because they have a post-traumatic experience, or they're in a...
And that's it. Is it endogenous anxiety, which means you're wired that way?
Right.
Or exogenous anxiety, which means there was a life experience for that. For us, I don't think it matters too much because the treatment is the same. The difference is duration of treatment.
But also, if it's due to like sleep deprivation, people become much more depressed and anxious if they're sleep deprived.
Yeah.
Or they're fasting. I find a lot of people who are fasting
Get hangry?
or not eating balanced meals throughout the day, they can often have some mental health issues promoting anxiety or depression, or not eating healthily, high carbohydrates.
Do you medicate?
simple sugars.
Do you medicate or do you?
I try to do those things first, like the exercise, the hydration, the minimize alcohol and caffeine, all those kind of balance your brain sort of things first.
Get a plan.
Get a plan
Get
in
a healthy
place.
plan.
But I do not hesitate to start a medication.
Yeah.
Because I can't go in and check somebody's chemical levels, so we don't really know. We can't check the chemical levels in your brain. They're too transient. They're mostly in the cells. They come out for a split second, and then they go back in. They're taken up, and that's why the medications that we use are called reuptake inhibitors, meaning it gives those chemicals more time out in the environment to have an effect. So it's reuptake inhibitors.
And if you really want to chase the rabbit, look that up on Google because there's all these arrows going to, because your body will self-regulate itself.
Right.
So if you block a reuptake.
Homeostasis.
Yeah, so I'm a big fan of behavior. There's a really wonderful therapy called meditation and prayerful meditation. The hard part is that Natalie and I were talking about this over the weekend. We are very uncomfortable as a society, quiet and in our own heads, right? And so I give a lot, patients love me or hate me because I give a lot of homework. But there's a book called Meditation for Fidgety Skeptics. That's me, right? I'm like, come on, woo-woo, right? But this guy, you can read the book. I think it was it'll come to me in a second. Dan Harris, I think. But what he found was he had less intrusive thoughts, less bad behavior, less anxiety, all the things that were really bad for him but harming his health. So the phrase I use is you need to meditate, not medicate. And then if you have a problem, we can medicate. I'm a big fan this will not work for endogenous. Do you ever use EMDR, like Dr. Brown?
I haven't.
Yeah. So Lisa Brown is a PhD. She's winnowed down her practice a lot. But she has a therapy called eye movement dissociative response. And the neurology of this is so over the top and cool. It's the best. But basically, she has you, or an EMDR specialist, they have to be certified in this eye movement dissociative response. But what they do is walk you through what causes your anxiety or what causes your PTSD. And she cuts the hardwire, cuts the power cord between and this is only for environmental, right? Not endogenous. For environmental PTSD, anxiety, those sorts of things, panic. It'll cut the hardwire between that exposure and your physiological response. And you can tell, well, I'll give you an example. My brother's he's an Afghanistan vet too. And we were driving on the highway and we were going to an overpass and you could just see him brace. You could see him tense up. I'm like, dude, we're not in a Humvee. We're not in Iraq, you know? And so, but just going in an underpass, he has it to this day, but he medicated with nicotine. He smoked like crazy, now he vapes. But he's a perfect case for he needs to meditate, like prayerful meditation, some sort of meditation. And he also needs to do EMDR to kind of cut that hard.
But I do not hesitate in starting a medication. They are not.
You got to get them through the day of the week.
You're right, exactly. Yeah. They are not something that I would call a crutch or a fault. I mean, if somebody has diabetes, you wouldn't hold the insulin to treat them. Just as if somebody has depression or anxiety, I wouldn't hold that treatment to help that.
But if they're going to go on an airline flight and they're afraid of flying, I'm going to give them Xanax, right? If they're going to go to an MRI, I'll give them Xanax.
What is the newest research on Alzheimer's? We kind of already addressed that.
Exercise.
Who do you suggest seeing for diagnosing inattentive or ADHD for adults?
How would you diagnose me, Dr. McGarvey?
I do, all the time.
I know. She says, she makes sure I exercise before I come to these.
That's what I tell them. You need to go out and run 3
miles. Get on the treadmill. Get on the treadmill for an hour. You're going to be fine.
We do a podcast together, and I tell them, you better go run before you come.
Because she knows I'm like, squirrel. Oh, look, a quarter.
So I suggest psychiatry or psychologist as far as diagnosing ADHD. I don't, as a neurologist, do a lot of behavioral, unless it's kind of dementia or cognitive decline, something like that.
Make sure it's ADHD or ADD first, though.
Yeah, I would say psychiatry.
Because it's really not a disorder unless it disrupts your life. Okay, so in either way, it's not an illness per se.
And not everybody needs to be medicated. Just because you're inattentive or can't focus, you can find other ways of like exercise.
Like my older brother that I was telling you about had a perfect math SAT but barely graduated high school because he couldn't focus. But the military is perfect for guys like that because if you're overly focused in a high threat environment, you're a casualty. Whereas if you're like movement, you survive.
Yeah, and I think kids
so it's not abnormal, right? It's a disorder because you have to sit in a classroom like this.
Right.
But you have to get them through the day, the week, the month. And if medication does that, I'm all for it. And just bear in mind, it's not abnormal. But make sure it's ADD or ADHD. That's where the DSM comes in, the diagnostic statistical. Psychiatrists have it together. They can actually do a blood test and tell you what receptors you're deficient in. It's a genetic, they have it. So they can tell you, no, you're on the wrong antidepressant, you need to be on this one. And they're underpaid. They're the most underpaid, I think, profession, most needed and underpaid profession in our line of work.
There's also what's called neuropsych testing. It's a test that's like a day long or several hours long, where you go to a specific environment and a neuropsychologist will, Dr. Nathan Palmer actually came and talked with me at the other library, Hussey Mayfield in Zionsville, about, what did we talk on? It was probably on dementia. I think we spoke on dementia. Anyway, they look at all the parts of your brain and how you're learning and how you're retaining and what do you retain and how you're focusing. And so that's very helpful too in making that diagnosis.
And it'll regionalize your brain. Do you have trouble with immediate recall, like what's my name? 1 minute, 3 minute, 5 minute long-term recall, like what'd you have for breakfast? What year were you married? They'll also do your speech. Is it more of an expressive problem or a receptive problem? So that when I talk to patients who need a memory testing or neuropsych testing, I tell them it's regionalizing your memory dysfunction. So like Bruce Willis has a type of Alzheimer's called primary progressive aphasia. So his memory is intact, but he has trouble talking.
But the inattentiveness, sometimes it is because we're trying to do too many things at once. And we're very used to this, you know? We're doing the dishes, we're talking to somebody, we're making sure we keep an eye on the food.
Get a text.
And then you get a text, and then somebody's on the phone. I mean, you're trying to spin, what I like to say, you're just spinning all these plates, like that old variety show where they have the pins
Mom,
up,
look.
and you're spinning the plates in the air. So it's a lot of...
Those are the best distractions in the world.
It's a lot of things going on at once. So if you calm down your environment and try not to multitask so much, then you're going to be focused a lot more. So if somebody, my husband or Doug or somebody is kind of going off on one thing after another, I kind of bring them back. I might put a hand on their shoulder. I might touch them. I might say, I get close. I say, I want to talk to you about something.
Is this one of those moments or just
I want to talk to you about something in specific. And so that was my mom face. That was my mom face.
There's also, you guys know about the Pomodoro method? So Pomodoro, I think 30 years ago, 35 years ago, they realized they did video cameras on college athletes, and the ones who would take breaks every 20 minutes did better in school. So your brain will only stay on the hamster wheel for about 20 minutes, and then it needs a break. Probably that's why the teacher had me stand up, now that I think about it. But it's just setting, if you have a kid with ADD or a grandchild or whatever with ADHD, get them a little egg timer, set it for 20 minutes, because then it becomes a game.
Movement breaks.
Right, and so it's like, see how many pages you can do in 20 minutes, instead of going to the top and reading the same paragraph over and over again. So you've made it into a game, you've made it into a challenge.
Can you talk about vertigo? So
yes, it's my biggest failure in neurology.
Oh, that's sad.
I have vertigo. So.
Do you really? Describe your vertigo.
Mine came on after my military service.
Tell us what came on.
I sneezed, and I started getting eye beats. And I had to lay down, I broke into a sweat. I had to lay down on the floor. I had this lab coat on. I'm like an intern.
So when we talk about vertigo, we're talking about the sensation of something moving around you or your body moving in the world when actually nothing's moving.
Yep.
So you might feel a spinning sensation or kind of a off-kilter sensation. It might make somebody feel like they're falling. It can, you can see what he was talking about with this is your brain is trying to make sense with what your eyes are saying where you are and what your brain is saying where you are. And so your eyes are moving in the direction, isn't it in the direction of where you feel you're like,
it tries to pull you back.
Yeah, it tries to pull you back on the line.
So it's opposite.
So it's the sensation, and oftentimes it's because something's going on with your inner ear. You have semicircular canals in your ear that go the three directions, kind of like an XYZ plane on both sides. And within those semicircular canals, you have fluid and you have hair cells. So those hair cells sort of flow in the kind of the breeze of the fluid that's there. And when you have crystals that get clogged and make the hair cells not flow, like all of them are chanting the same song, it gets confusing, and your brain is confused because your hair cells are not all on the same page, and they're telling your brain your body's in a different position than it actually is. So it's you can actually have it. That's the first type. That's peripheral vertigo. You can have central vertigo where it's caused by a problem in your brain. And that's why it's really important to get several tests. One is a video nystagmogram where they put goggles on you and they have you look at different things. They can keep your eye on focus and see what your eyes are doing. And the second thing is brain imaging, looking to see if there is a brain problem. Has there been a stroke? Is there a tumor? Is there congenital abnormality? Anything that's affected the brain in the areas that make you aware of movement.
And we're not very good at treating it. If we can find the cause, great. But
If it's a peripheral problem, I think we're much better in treating it because you can do the Epley maneuver where you turn the head, you lay back, you wait till the eyes stop twitching or having nystagmus, and then you turn it back this way. But you want to make sure you're turning it the right way. If I exacerbate the problem because I don't know which side of my circular canal is the problem,
have a barf bag close by.
that is not going to help you at all. So it's really important to get that balance test, we call a balance test, a VNG or video nystagmogram, where they put goggles on, we do it in the office, and you're turning the head, you're looking at the eyes and seeing what happens. We can tell the difference between a peripheral vertigo problem and a central vertigo problem.
And there's a lot to the, it's amazing it works at all. That peripheral, the 8th cranial nerve, it's amazing it works at all. But when it goes back, we take it for granted until it's not working so well. But those otoliths,
Yeah.
I mean, those hair cells basically sit like this and the fluid goes by. And when it stimulates those two cells, you're getting an anomalous innervation. Your balance is basically a tripod, the nerves in your legs, your visual horizon, and this peripheral nerve. And when there's a mismatch, that's the sensation of movement in the absence of movement. And so now you're going to get sick because
It's like you're going this way. No,
2
I'm
out of
not.
3
You're
don't
going
agree.
this way. No, I'm not.
So, but for people who have like an evoked, if you care, like if people have an evoked nystagmus, like with head movements, I tell them to get night lights and don't zip their head around.
Sometimes looking far off in the distance can help.
The visual,
Low
like the
salt
car seat
diet
treatments,
can help.
look at the horizon.
Make sure you don't drink any alcohol. That's going to affect your cerebellum. It's going to make it more. It's going to make it worse. I don't know if anybody's had enough alcohol, but I hear
Oh,
that if you drink enough alcohol, you can get that vertigo sensation also.
the bed spins.